I'm awfully happy to be with you this afternoon. I know that you've all worked a hard day. You got things to go, as Larry mentioned, and we want to get you out of here, but not before we give you hopefully some thoughts to take with you to help you and your company, which is Baptist Easley Physicians and Baptist Easley Hospital, in your future endeavors. Okay, so with that, we're going to talk about point of service payment. Now, some of you may have heard this term, and the most common term used is point of service collections. And just when you hear the word collections, what does it do? It says, oh, I'm not a collector. I don't like to collect money. I like to collect stamps. I like to collect baseball cards. I'm not a money collector. But I want you to understand, this is a point of service payment. And we'll talk about the distinction here. And the one thing you've got to remember, and it's very hard to do because you know your patients, some of them are your relatives, friends, but it's not personal what your job is. Your job is to perform a service for the patient and perform the job description that your employer gives you, okay, which involves collecting payments, okay? So let's talk about a little bit of the history before I go into this. 20 years ago or so, people who had insurance would pay the doctor or the hospital 80% of what their usual and customary charges were, and the patient would pay the other 20%. But the money was so good that it really didn't matter if you got that $20 copayment, because you're getting $80 for the office visit. You were getting, 80% of the charge for an MRI. Big numbers. So a lot of doctors and healthcare providers in general said, it's okay, we're making money off of this. Well, what happened? Around in the 1980s, managed care hit California, as I recall. And what managed care is we're going to manage the way you use healthcare providers. We're going to pay certain providers who happen to be in network, we're going to give you as patients to those people. So what happened in California is managed care, and everybody on the East Coast, and I remember because I was living in New York or New Jersey at the time, and they said, those crazy Californians, that'll never happen here. Well, 5 years later, guess what happened? Now you have a situation where instead of paying 80% of charges, an insurance company has come to Baptist Easley and every other hospital and doctor and said, okay, we're going to give you a panel of patients. We're going to say, you're going to be part of our network. So when our patients want to know where to go, they know that you're one of our network. And in exchange for that, however, we wanted to pay you less than what we used to pay you. We want you to discount your services. And any idea what the average reimbursement rate for your insurance carriers here are? So if you, for example, it's a $1,000 bill, do you have any idea what the insurance company is going to cover? I'm sorry? Okay. I believe we said it was what, 27%? Yeah, on the average. So 20 years ago it was 80%. Inflation's happened, people make more money, it costs more to live, and now the insurance company is paying less than they did 20 years ago. So that's a little bit of a problem. So now, in the last few years, people started to say, wait a minute, we can't just live off the insurance company's money anymore because that's break even maybe. So we got to look at that other piece. That other piece is the money that the patients owe. So that's why the emphasis on the last probably 5 years has been really heavy on point of service collections or point of service payments. Now, the Affordable Care Act, also known as Obamacare, has now changed it yet again. All right, everybody familiar with Obamacare? Okay, how many people know how it works? Okay, that's a whole separate session. But here's what's happening. And I want you to think about this. We're going to start now down the trail of an American consumer. According to the Affordable Care Act, on January 1st, 2014, which is what, 27 days from now, 28 days? We are, as Americans, required by law, by federal law, to be insured. That's a legal requirement, same as having a driver's license to drive a car, same as paying your federal taxes out of your paycheck. That is a requirement. Now, on the flip side, everyone now has access to insurance. Now, who didn't have access to insurance before? Chronically ill people, people with pre-existing conditions. You know, there was a large percentage of people who couldn't get insurance. Not the average person, but a large people that just couldn't get insurance. Well, the Affordable Care Act has solved that problem because the insurance companies can no longer deny a person for pre-existing conditions. Okay, and you don't have to shop around anymore. You've got healthcare.gov or one of the state exchanges where you can go and sign up for insurance, pick your carrier, pick your plan, so you have access to it. That's a good thing, right? Everybody can get insurance now. Well, here's the problem. These plans range from a platinum down to, say, a bronze, depending on how many plans there are filed in the state or in the area of the state you live in. So you may have 2 or 3 choices here in the Easley area. And then you have plan choices of the plans, but also the carriers. But obviously, the higher the plan, the more you're going to pay. The lower the plan, the less you're going to pay. That hasn't changed about insurance. The government is also subsidizing these premiums for people based on income and household size. So if you have a household size of 4 making $30,000 a year or less, you may get subsidies so that your monthly out-of-pocket premium for you and your family may be $111, for example. Still a good deal, okay? Well, the insurance company who filed their plan, they filed their premium rates and everybody's approved them. So they'll get your $111 plus the subsidy of the difference between what the plan costs from the federal government, which is paid for by all of us taxpayers. But in order to make it affordable for everybody, the Affordable Care Act, they built these plans, and some of them have deductibles of $10,000, which means you got to pay the first $10,000 of your medical bills before your insurance will kick in and pay your doctor or your hospital. Here's what then happened. Then the Blue Crosses of the world, the insurance companies of the world got smart and said, oh my gosh, you know, if all these 21-year-old healthy people don't come out and enroll, which they're not, historically they don't, then we're going to be stuck with all these folks who have serious diseases that we didn't have to give a policy to before. In fact, we denied them because they had pre-existing conditions, or we'd cover them, but not for that. Well, now we're forced. The government says we have to insure them. So how do we get our money back, or how do we keep making money? Insurance companies have one goal in mind. Does everybody know what that goal is? Making money. It's not paying claims, it's making money, okay? They're a business, and you understand that. But what they've now done is come back to Bob and Larry and to CFOs across the country and says, okay, we're going to pay you an even lower rate as a percentage of charges than we did before, because now we're going to have to eat all these costs of this expensive health care. So now they're expecting the hospitals to bear the burden of the federal law. So what does that all mean? Where's the money going to be? Where's the money coming from to keep the business open? Maybe, all right, so now it becomes a time we've got to start understanding that we need to collect money up front when the patient comes in. Because no, the taxpayers aren't going to bail it out. You know, it's unclear if Obamacare will be around in its current stage after the 2014 elections, but no matter what happens, rest assured, the history has shown us that the insurance companies have enough power to keep pushing down on the providers to the extent that they can keep their profits up, which means you've got to work harder to get the money, okay? So, point of service payment. We're in a business, whether you like that idea or not, you're in a business. You have you get paid to do a job. People pay to come see us, okay? It's not personal. You should never feel guilty about asking somebody to pay money that they owe, because it's not personal. More important, it's in the typo, it's our responsibility. It's our responsibility to keep our business healthy, because when a business is healthy, you get better benefits, better pay, better surroundings, all the things that go with a successful business versus a business that's failing. And I have one experience. I got called into a hospital in Alabama about 3 years ago. Small critical access hospital, I think 14 beds in the middle of nowhere, but it was the only hospital around for a ways. And their AR was something in the area of $14 to $15 million because nobody did think. I mean, it was a community. Aunt Mary came in, you know, Uncle Fred's there. You know, they didn't have the money to pay. They don't have insurance. It's no big deal. Okay, they weren't billing their insurance. A lot of things were going wrong. They brought us in. We started following up with the insurance claims that are outstanding. We started calling patients, asking them to remind them they need to pay their bills. And one day, one of my reps came up to me and says, "You hear anything about XYZ hospital?" I go, "What do you mean?" You know, he goes, "Well, one of our patients I just talked to tried to go down and make a payment and said the door was locked." And it was. Padlocked the hospital. No health care for miles because they just ran out of money. They couldn't afford to pay anybody. So I'm not trying to scare anybody, but I want you to understand it is a business. And business people make good business decisions. If something's not profitable, if there's losing money, at some point in time, you may have to not provide health care in a specific area, or especially if it doesn't make sense, if you can't afford to keep the doors up. Okay? So let's look at the cost factors involved. The facility, it costs something to be involved, to be in a building. The lights are on, we're in a building, right? Somebody's paying for this building, paying taxes on it, paying to keep it maintained, paying him to film this. But at the end of the day, it's, you know, you have to have a place to come to, right? Then there's compliance issues, because a few years ago, everybody had paper charts, and you had a high school girl that came in, made minimum wage and filed every afternoon. Now we've gone to electronic health records by law, okay? There's cost in that technology, storing the technology, giving it, you know, complying with the HIPAA and EHR. That's a cost in there. Training. You are the third session today, and you're the smallest by a little bit of all the three. But that means that 90 to 100 people have been paid to come to training today for an hour. That money has to be paid for by somebody. Support staff, that's you. I assume you all work for pay. No, any volunteers in here? Because if you're volunteers, I guarantee you longevity. Okay? Your nurses and your doctors. And then somebody has to get the bill, you know, the insurance company, you know, the bill has to be coded and billed, and the patient has to be billed. All that costs money. Now, I don't know how much it is, and I haven't asked Mr. Pope because I'm not sure we want to disclose that, but at the end of the day, that's a lot of money in your practice, whether it's 4 doctors or 4 providers or 10, no matter what. These are costs associated with running your practice. All right, by the way, let's see if anybody's cheated. How much does it cost to send a patient bill out? Give me guesses, go ahead. I'm sorry? $5. $5? Anybody think less, more, about the same? You're saying more? Okay, this is Price is Right. You can win a new car if you get the right answer. Oh yeah, no, you've been in. All right, the number we tossed around today was $5.86. So think about this. If a patient comes in and you don't collect their $20 copayment, now you're going to spend $5.86 to send them a bill. If they don't pay that bill, you're going to spend a second statement for $5.86 the next month. So now you're $11 and change into a $20 bill. How much money are you making off that $20? You're probably not. You're losing money because that need to be allocated elsewhere. So we'll actually refer back to this in a few minutes. But it's, you know, there is a cost associated with providing quality health care, which is what you do and you're a part of. But it is a business. Where does the money come from? We talked about insurance payments, which aren't, as they say, ain't what they used to be. Copays. You have an opportunity every time a patient walks in. Most insurance plans have a copay, you know, and whether it's Medicare, even Medicaid in some cases, certainly your Blues, you have a copay. And then you have your peer self-pay, which is the person that called up that doesn't have insurance that says, hey, I want to come see your doctor. I want to get some treatment here. I want to get some, some services. And then, of course, charity care, which you may or may not, doctors don't typically share in any kind of pool of charity care money, at least not in this state. They do in certain states. And the bad debt, which is the people who, like our company, that, one of the things we do is bad debt, and Bob hired us to do your bad debt. So we're collecting all the money that you didn't collect at the time of service. And we're taking a fee for that. So it's discounted. The self-pay is discounted by 30% out of the gates, pure self-pay. So the patient gets a 30% discount out of the gates, and then we charge a fee on top of that to collect the money that theoretically could have been collected 4 months ago, 5 months ago. But we do return some of that money back to you. So now, that's the business side. I probably didn't tell you anything you didn't know, but I want you to think about this is a business for a second. Let's talk about consumer expectations. We're all consumers, correct? We all buy something. Some of us more than others, some of us shinier than others, some of us even are kind enough to buy cookies. Thank you. So a consumer expects the following. Let's talk about retail shopping. Anybody here have a favorite store they like to shop at? Kohl's, Marshall's? All of them. There we go. So I like to go shopping too, in small doses. But when I go shopping, it's not like an emergency room situation where you have an auto accident, you fall off a ladder, get hit in the head with a baseball or something like that, where you're a lot of times going to have a choice of, you don't know where you are, let alone which facility you're going to. That's where you don't have a choice. You have a choice whether I go to your family care facility or the one across the street or across town. That's a choice I make to come to yours. You then have to understand that my expectation as a consumer should be that I've got to pay for this. Okay? So that's, not picking on you, but you did sit up front, so. Okay. So here's my point. There is no difference between what you do, and that is, well, there's a big difference because providing health care is a lot more important than selling, clothes. But the consumer expectation, my expectation is, I've got to pay for my services. Yes, I may have insurance that's going to pay for some portion of that. Now, it doesn't mean I don't have to pay, which some consumers may think, but it's our job to educate them and ask them for the money. Okay? So, if you have people who walk in who say, I need to see a doctor, you're going to tell them what? The office visit is $65 or whatever it is. Any treatment above that, test, etc., will be extra, and that will be due today. Anybody see anything wrong with that? How many of you do that? Since the overwhelming opinion is none, why don't you do that?
It's not the process.
Okay, so explain to me the process.
Checks in the patient, check out, checks out the patient, which deals with the treatment and the collecting of the money. At that point, the patient has already been seen. So, we would have to collect the money up front.
Mm-hmm.
We actually do that at our office.
Some do.
We do upfront.
Okay. Yeah, you can't always give them an accurate number because you don't know what's going to be done. But you can certainly collect if they have an insurance card, which has the copay written on it, and you can say, your copay is going to be $30 or $25. If it's a person who walks in off the street or an uninsured person that called up and chose to come to your facility, you have every right and obligation to your business to ask them for the money, at least to cover the office visit. Because what do you do with a person who says, well, I don't have any money? We're going to talk about that in a minute.
Partial payment.
Huh?
Partial payment.
All right, but here's what I want you to, I'm sorry.
What about if it's an ER referral to a specialist office?
Well, if it's a referral to a specialist
Like
office,
if they have a broken bone and need surgery and they have no money.
that is up to your practice policy. It's not, I can't, tell you what to do.
Fred, it's obvious that we don't have a lot of standardized processes, and that's something that we're going to be working on in the very near future so that we all are being consistent.
Mhm.
And it's like, one office does it one way and one
Right.
does it another way, and.
Well, like she said, part of it's her specialty and part of it's their family
Right.
practice.
And it's,
There can still be standardized processes that we use, so.
We collect our co-pays and balances up front at check-in,
mhm.
but if by chance we miss them at check-in, we get them at checkout.
That's what we do also.
Our
Okay.
process, because there's only one person doing check-in, is basically, because I do check-in, is to get all the co-pays that I possibly can, because there's a lot of times, there's not a whole lot of space at our office up front. They'll end up going out the door if I collect everybody's copay, so I get as many as I possibly can up front, and then checkout's responsible. We have a stamp that I usually put on the routers that shows I did not take that person's copay, so that checkout knows to
Right.
ask for it.
Okay. And again, these are, as Ms. Pope said, there's probably some things that you need to standardize. But what I want to talk to you about today is, you've heard this before. You've heard collect the co-pays, right? And this is not new to you, so you're going, what's this guy going to tell me? All right, well, let's talk about your mentality, and let's talk, we already talked about the shopping experience, right? It is a cost. It is a price. There is something that the patient owes, and every patient should and probably does expect to pay. Some hope they get away with not paying. Some would pay if you just asked. Okay, and we're going to talk about how do you ask for the money. But a lot of times I find front desk folks, and we all tend to kind of look at people and go and judge them by the way they look, or their age or whatever. So I want you to think about some of these people sitting in your waiting room that you feel kind of bad asking them for money. Okay, so what do they do with your money? Well, they leave your office and go to McDonald's, get a Big Mac, order fries and a large Coke. Okay, do they need to eat that? Probably not. Probably not a good idea, right? We all know it's not healthy, no matter how good it tastes. Cigarettes. They're walking out the car, lighting up a cigarette, going to get a carton for $50 down at the store. They didn't pay your $20 copay. So, and believe it or not, some of these are conscious thoughts in their mind about, if I pay my copay, I can't go get a carton of cigarettes. I can't go out to lunch. So, again, it's all about choices. They have a choice of using you or not using you. You have the obligation to your company to ask them for the money, and we'll talk about again the right way. This is the one I love. Get a waiting room full of people texting, talking on the cell phone, and you say, your copay is $20. Hold on. Oh, I don't have that, sorry. You got the cell phone. Somebody's paying for it. And, depending on the plan, the data plan, you could be paying $70, $80 a month for this. So I want you to picture this as the average consumer is not going to be able to get a discount or not pay when they go to buy groceries, cigarettes, food, or their cell phone. They don't pay the cell phone, it gets cut off. All right. So why should healthcare be any different in terms of consumerism? Cable TV, we see this a lot. Of course, you don't deal with this, but once the accounts don't get collected, they come to a collection company. A lot of times, you're talking to the patient who say, hey, I don't have any money, and you realize they're listening to HBO. It's like, but don't you pay extra for HBO? Okay, we'll actually ask them that question, because the point being, do they need this? Any other examples of things you see or you can think about with patients, what they do with the money that could be going to pay for the health care?
They go out and get in a brand new car.
Yeah. A quick side story, when I was in New Jersey a few years back, I ran an eligibility, I had an eligibility group. They'd go out and help people enroll for charity care. And I had a field rep who called me one day and said, Fred, I think I'm at the wrong place. I go, why? He says, give me that address again. So I looked at the screen and said, well, it's 7100 Jamison Road. He goes, that's where I'm at. He said, but there's 2 Mercedes parked in the driveway of this beautiful home. The guy actually did not pay, so he wanted to apply for charity care, and basically stalled for about 4 months on having to pay his bill, and had the audacity to apply for charity care when there were 2 Mercedes in a beautiful home. So you just don't know. And there's people that come to your practice that you know their families, they're maybe your family, but you can't judge everybody. I got a friend who's 67 years old, does not have an income, other than Social Security. He's retired, and he's got Medicare for insurance. So if he walks in and ever says, nice old guy coming in the door, I really hate to ask him for that because he's on Medicare and Social Security. Do you feel that way ever? You see somebody come to the office? I really hate to ask this person because she doesn't look like she has it or eat it. Well, my friend has about $1.8 million in the stock market, $1.8 million in liquid assets. But if you didn't know that and you just looked at him and said, nice old guy, I hate to ask him for money, because if you don't, he won't pay you. I mean, he's cheap, so he got all this money. But the point being, don't prejudge people. Just follow a process. It is the gallon of milk. It is the $2.99. That's how much it cost. It is the $49.95 for the blouse. Today's copay is $35. That's how much it cost. Consumers get that. You're not going to upset people by asking them to pay what is generally posted either on their insurance card, or you tell them up front before you walk in the door, do you have insurance? No. Well, then your office visit will be $65. Period. Okay? So here we get into what to say and when to say it. One of the easiest way to say it is, your visit today is $65. We accept Visa, MasterCard, checks or cash. Which one are you going to using to pay today? It's pretty simple, right? It's not rude.
Not giving them an option.
No, I am. I'm giving them 4 options.
Yeah, no, I mean, like, you're
Or I give
not
them,
saying,
Are you gonna pay?
are you gonna pay? You're
Right.
saying, this is what it is, how are you paying?
or Mrs. Johnson, do you have the money for this? Do you have the copay today? That's the approach. And it's a simple approach to change, okay? And I told the story this morning. I'll tell it again. 2 days ago, I went to my primary care for a routine follow-up to, annual blood tests and so forth. So I walk in the door, and I walk up to sign in, and the receptionist, it's a big practice, and she looks up at me and she says, "Hi, Mr. Landon." I say, "How are you?" She says, "Okay." She says, "Now we're collecting copays at the front window rather than on checkout now." I said, "Okay." She said, "Your copay is $20 or $25." And she smiled. Pretty smile. Nice young lady. And I kind of hesitated because I wanted to see what was coming next. And she just kept smiling. And I said, "Well, I guess I got to pay now." So I gave her my card. My point being, when I hesitated, she just kept smiling. But she wasn't going to add anything to what she just said, because there was nothing to add. She didn't say, "If you don't have it, I can mail you a bill." Or, "If you don't have it, maybe you can pay us next time." Or, "If you don't have it, it's okay." She just said, until I finally pulled my wallet out and gave her the card. So, point being, you can smile. Give them these options. There's nothing wrong with this. When you walk up to the cashier at a grocery store, you might hear, "How you doing today, Mary?" "I'm doing great," okay? Because she knows you, your neighbor or friend, cousin, whatever. And she rings everything up, so it'll be $39.95. That's all she says. Doesn't say, "Do you have the money to pay it?" What you do often, and what we do in this business often, is assume they can't pay, or because they don't respond right away, we start offering them options that really we shouldn't be offering them. That's plain and simple. Your copay or your office visit day is $65. We accept credit cards, checks, or cash. Which one are you using today? Now, see the today's visit? I want to make sure I'm making a point of that. Using the word today, when does it due? What is your postage policy in the office about payment for services? Huh?
Day of service.
It's due on the day of service, which is today if you're there, right? So it's due today. So why would we say it's due next week? Or we'll send you a bill. Okay. This is one I find very low number of people do. If you look at a patient's account and they've got a payment for today, but then you realize they didn't pay for last month's or last week's visit, very seldom do I see somebody go back and say, "Ooh, not only do you owe $50 today, but you owe $50 from last week. Now you owe $100. So my recommendation is, what arrangements can you make today to clear up your prior bills? Which one are you, We accept Visa, MasterCard, checks, or cash. Which one would you prefer to use today? Today. Sending the message, right? Because if you don't ask, a lot of people won't volunteer. Some people will walk up with a checkbook in hand, their credit card out, the cash in their hand. How much is today's visit? A minority of people, a small minority. Most people are going to wait for you to tell them how much you owe. Any questions about this? Is this what you do in your practice? How do you ask for copays or payment for services? Do you have like a standardized way of saying? What do you say in your practice?
When the checking
See,
girl-
Michelle, you nodded your head. That always
Yeah.
tips me
When
that I'm going to ask you.
The checking girl asks, or even when they're checking out, we'll say you have a $25 copay and a $200 balance.
Mhm.
And they say, well, usually they cut you off there and say, well, when's the balance from? And we'll look it up and tell them. And then they'll say, okay, I want to pay.
It's not possible they saw those statements come in every month on those, right?
No, didn't hit their mailbox.
Mhm.
And we haven't had any problems with patients saying, well, I can't pay any of it.
Mhm.
They'll usually copay and then some.
Good.
of it.
A lot of this is just about expectations. They expect to pay, you expect them to pay. Life's good. Nice smile when you ask for the money, and that's fine. Okay? Now, again, your policy may differ, but there are cases where many practices will say, when you tell them today's visit is going to be $65, oh, I don't have any money, they'll come right to, well, do you need to reschedule? Because you're making the point. You called up and made an appointment. You should have expected to pay, and you didn't have. Now you don't have money. Be glad to reschedule. And again, we're not talking about the emergency patient. We're not necessarily talking about the cardiology patient, but that's something that your practice has to determine. Especially if they have prior past due accounts from a month ago, 2 months ago. Can they see past due accounts or bad debt accounts on the system? So you know if a patient's got an account that's been written out to a collection agency. So, now you've got this patient who's obviously come to the belief that health care is free to him. So when he walks in, he doesn't expect to pay, and he knows that he's not going to. But yet he still wants to see the doctor because I don't feel good today. I got a sore throat. You don't have to see him. That's my humble opinion. But again, that all boils down to the practice policy. Watch how many people pull out their money. Oh, no, I can go get I'll be back in 5 minutes. Go out and put it from the left pocket to the right pocket, got the money, let's go. Okay, common objections to paying. I thought my insurance covered this. Got an insurance card. And by the way, this is kind of a weak one. Why is this a weak comeback? Let's assume they have insurance cards, right?
They should know what their deductible is.
Well, they should, because how'd they get their insurance? Hmm?
I don't think most of them have blue.
I don't disagree with. How do most people get insurance? They select it, they choose it, and they buy it. And if my deductible is $5,000, it's because I don't think I'm going to get sick very often, and I'm going to want to pay the lowest amount of monthly premium that I can. That is my choice, my decision. Why should you have to suffer with it because I chose a high deductible plan? Right? This is business. So, I didn't realize I had to pay today. I don't know what your practice histories are in various areas, but maybe that was the case in the past, and it's a culture that you have to change. And some patients are going to be all aghast as, I got to pay today? Okay. Now these are the same patients, by the way, that's sitting facing the payment for services is due on the date of service, but don't see it because they're on their cell phone. That, I got to pay today? Really? So, and you hear this. I have secondary insurance. That's kind of a valid objection, and we'll talk about that again in a moment. I left my checkbook at home. Okay? I ran out of the house. I was running late. I got here, and I left my checkbook at home. Or I can't afford to pay this today. And again, we'll talk about the rebuttals or the comebacks to these in a minute. And I'll mail it when I get the bill. You hear that from patients? Just bill me. Okay? which, by the way, we all know cost how much?
$5.87.
Well, it's $5.86, but you went on the rounding error. Think about it. A $25 copay. Now I got to mail you a bill for $5.86 because you didn't come prepared to pay, and my dog ate my debit card. You don't hear that one?
No.
Okay, all right.
I haven't, although I'm thinking
Okay.
I will probably do that.
All right, so before we go there, let's go back to that. What other objections do you hear in your practice other than this general category? Did I cover them all?
Now, I'm getting a lot of, I've met my deductible, because I'm in outpatient services,
Mm-hmm.
but then they don't realize they still have the out-of-pocket that they have to pay towards too.
The co-insurance. Yeah, and we talked about that a little bit this morning, and that's going to come with some systems, hopefully integration in terms of being able to identify, like the hospital already has that ability to find that out at the time, but you can also pick up the phone and call the insurance company, especially if you're talking about a very, let's say that their deductible is met or isn't met, and you're looking at a $1,000 procedure. I'm calling the insurance company to find out, because then if there's an argument between the patient and their insurance company that they chose, that they bought their insurance from, I'm not the bad guy here. Okay. Any others?
I've heard on occasion that I've made prior arrangements with your billing office or things like that, and like we really don't have any, unless we call, which depending on how many you get a day, you can call, say so-and-so, made arrangement with you guys or a billing, plan or something like that, but they'll be like, I've made prior arrangements.
Well, would that, policy-wise, is that if somebody calls the billing office and says, hey, I know I owe $300, but I'm paying them $50 a month, I got a payment arrangement, isn't that documented on McKesson?
But regardless, that's still on prior balances.
Huh?
That's still on prior balances.
Well, but would they call up and make with the business office say, I want to come in tomorrow because I'm not feeling well, I don't have the money, can I come in?
I've never, I don't think so.
Okay.
If we get those calls, we refer them to the practice.
Yeah,
Okay.
So we don't do that.
So, a nice way to say it is, can you tell me who you spoke with there? Because I don't know who it was. I spoke to somebody. Okay, because.
Yeah, and that's where you run into all those, excuses.
Mm-hmm. Okay. And if the patient is trying to willfully avoid paying you, and they hang up and they're going to go to the other practice across town, God bless them. Send them to your competition. That's where you want them to be. All the non-payers need to go over there.
We don't have a whole lot of that, but that is something that I do here on occasion.
On occasion.
I've made prior arrangements with the billing office.
Here's a question for you. Of all the patients you see who come into your offices that owe some type of copay or coinsurance, what percentage of those people do you actually collect a payment from on the date of service?
It just depends on the type of day you get.
Yeah, it really does.
I mean, it really
Why?
depends.
Why would it depend?
Because it depends on the patients you see.
Why would that be different?
Because if all your patients that day have, all of them have Medicare, it's gonna be different than what you have out of commercial patients.
Why?
Because what they owe is gonna be different.
Okay, but you still can collect that amount, right? My question is, what percentage of the patients do you collect the money from that they do owe? Whether there's a $3.13 Medicaid copay or a, $500.
And with different ones, you're
Okay.
gonna get different
So-
responses.
Right, but here's the way you've got to change. You've got to look at this as a business, and a gallon of milk is $2.99. Their copay is $3.13. Their copay is $500. It is what it is. It's what they agreed to, and it's what your price is and what you need to stay in business. Doesn't matter if they're Medicaid, commercial, Medicare, self-pay. It doesn't matter. I'm not getting down on on society, but it doesn't matter. That is your price. If you don't want to buy a gallon of milk for $2.99, get a half gallon for $1.50. Or if you don't like the prices at Walmart, go to Piggly Wiggly. That's your choice. Just as you choose, I choose to come into your practice today and ask to get medical treatment, top quality medical treatment from one of your physicians, and good customer service from you, and a nice surrounding to enjoy my time in the office. That's what I'm shopping for. But I expect to pay because it costs money. That's what you've got to, and this, by the way, not to come down, but you're starting to profile people. Well, if there's a lot of Medicare patients, I'm not going to get a lot of money. They don't have a lot of money. They're Medicare patients. Just gave you an example of a guy with $1.8 million who's on Medicare. It doesn't mean that they don't have money. And quite frankly, most Medicare patients, expect to pay. This is the generation that unfortunately is dying out, that didn't believe in credit cards. If they couldn't afford it, they wouldn't go. So there is not that they don't expect to. Some of them don't have the money to pay. I got that part. But don't assume that none of them do. If you ask 100% of the people that you can encounter every day in your practice to pay you the amount that they owe you today, that's called for in your policy that they pay today, if you ask 100% and 80% of them pay, I guarantee that would be 80 times what you're doing today.
I have a quick question, and it may just be something that you guys handling office can answer. I hear you saying Medicare. As far as, like, if a person comes in, most of ours have, because it's internal medicine, they have double coverage. So whatever Medicare doesn't pay, most of the time the secondary picks up. If they come in and just have Medicare, and if they say, I've paid my $147 deductible, at that point, what should we be collecting from them? 20%.
Well, yeah, $50 they are.
Okay.
Yeah, Medicare is one of the easiest amounts to determine.
Okay.
But is it still not of a contracted rate with Medicare?
It's at the allowable rate.
So that's one thing that I've been running into lately is, okay, well, what is that?
If you don't know what it is, collect the 20%. It can go
Well,
on
that's
their
what I've been
account.
telling
Or
them.
gotta go
Worst
back.
case scenario, you can send them a Christmas card with a $5.94 check in it, right? And it'll cost you $5.86 to do that. Okay, so let's look at these rebuttals real quick. I thought my insurance covered this. Sometimes it's just an education process, that your insurance will pay a portion, but based on the plan you have, you're responsible for X dollars. How do you want to take care of that today? I didn't say how do you want to take care of that and stop, right? Because how do I want to take care of that is, well, send me a bill and I'll pay, or I'll make payment arrangements. How do you want to take care of that today? Let's make sure they understand today is the day it's due. You don't go bring groceries home today and send the money to the Piggly Wiggly on Friday. It's due today. Healthcare payment is due today. No difference. Okay? So hopefully you have the ability, and again, a lot of times the insurance cards tell you how much their copay is. So that's the insurance company that they chose to buy insurance from, gave them a card that says this is how much you owe every time you go to the doctor. Oops. Okay. I didn't realize I had to pay today. How many times did you hear this? A lot? Really? Okay. Please don't. I'm being filmed, not you. Okay. If you're in witness protection, it's okay because it's to the back of your head. All right. So when you hear I didn't realize I had to pay today, how do you respond? How did the folks? Not you personally. How do the folks around you respond to that statement? I'm sorry. Huh?
We usually say you're responsible to pay every time.
You're responsible. Now, do you feel bad when you say that? Because isn't it telling them like, didn't you know? Okay. Okay. Well, the first thing I look at on this, I'd smile real big, and I don't have a great smile, but you guys do. Our posted policy balance is due on the date you receive service unless prior arrangements have been made. How do you want to take care of that today? I went right back to, I didn't hear you say, I didn't know I had to pay. I just stated a policy, not me, not personal, it's business, it's on the wall, okay? They know that, they see it. But you're being nice, smiling, and coming back to the point, which is, okay, how do you want to take care of that today? Because some percentage are going to have another objection. Others are going to go, well, God, they've never asked me for money here before, and I've been covered for 25 years. Okay, You just smile. You don't have to say anything. Just smile. Give them the receipt, post the payment on the system, and next time they come back, they won't have that same objection. I have secondary insurance, and I think this is the easiest one. You know, verify that they got a secondary insurance plan, you know, and let them know we'll bill you if there's anything over this. Okay, but you're probably not going to collect copays or money today because you may not know what's going to cover what, right? And I'm talking about front desk point of service. I left my checkbook at home. What's your rebuttal to this one?
We take cash and cards.
We take cash and cards. What else? Somebody wants to.
We usually remind them, you know, we're here till 4:30, you're more than welcome to come back.
Okay, so.
Then you're still allowing them to be treated. Not that we've done this.
Mm-hmm. Well, now, okay, let me, I'm sorry to interrupt you, but let me just stay with that. It depends on, again, the practice. If this person has the, you know, solid platinum plan from Blue Cross, which pays the hospital 82% of usual customary charges, yeah, I don't care if he goes home and mails me that money in, you know, but you don't always have that option of making that, and you don't want to discriminate that way. But you need to have a policy. If you don't have one, you need to have a policy. But here's how I'd respond. I left my checkbook at home. No problem, we accept debit cards. Because if you have a checking account, you probably have a debit card, okay? Which usually walks around your wallet if you're a man or in your purse if you're a woman. Okay, you forgot your checkbook. That's not, don't worry, we accept debit cards too, or credit cards for that matter. Which one of those do you want to use? I stick right back with it. Which one of those will you be using? Because if they don't have a checkbook, they're gonna have one of the other two, most likely. And some people prefer to write checks because they think that they'll have a permanent record of this check as opposed to a credit card, which you lose track of. And that's their problem, their accounting problem, not mine. My problem is I need to get us paid today. And none of this is calling them a bad name, or you don't have to be rude to them. I can't afford this today. Well, one of the questions I've had, and now this typically is going to come out with somebody who's a pure self-pay, who walks in, office visit $65, he goes to the back, they run 3 tests, now his bill is $375. He says, I don't have that today. That's kind of reasonable. Didn't anticipate the other tests. Just thought he'd come in and get a prescription and be fine. So in this case, I might ask, well, how short of the balance are you? Because he came in prepared to pay $65, right, or whatever the office visit is. Does that mean that's all the money he brought with him? Probably not, because he's got cigarettes and he's got to go eat McDonald's. So when I say how short of the balance are you, if his balance is $300 and he says, well, I only got 100. Well, now I'm getting not 65, I'm getting 100. So I'm doing a lot better than if I just asked him for the office visit. By asking that question, well, how short of the balance are you? He may not have 300, he may have 200. And then you say, well, fine, I'll accept that, and then, you know, you can mail the balance in when you get paid next or whatever. The question is, how short of the balance are you, not how much do you have on you? Okay? Not, it's okay, we'll bill you. Chances are on pure self-pay, when they walk out the door, the odds of you collecting whatever's left on the balance is very, very low. Okay? And then secondly, when will you be able to make it? When will you be able to make this payment? You know, it's due today. So if you think this is 30-day terms, I'll mail the money back to you next week, next month. That's not the case. It's due today. Your mentality has to keep saying that. I'm selling this guy a gallon of milk. Okay? He's going to walk out and he pays me for half of it. When am I getting my money? Not, it's no big deal. We'll send him a bill for $5.86. Now, I was told this morning, this is your policy. You're not allowed to ask this, but sometimes, you know, practices say, well, you know, you say, well, I don't have the money today. Okay, well, I can hold your check until Friday or next Tuesday or whatever, when we have it. You know, that way you got money in hand that they're more likely to pay than, or cover the check than they are if you just send them a bill. But am I correct that that's not allowed in practice? Okay. I'll mail it when I get the bill. You know, again, you're making a statement. It's not untrue and it's not rude. With a big smile, our policy is that payment is due at the time of service. What form of payment would you like to use? That's just a statement. That is not personal. That's not attacking anybody. That's not being a bill collector. That's making a statement about your practice and offering the option of the form of payment. This is where most of you get hung up. Is your patient in your practice says, just send me a bill and I'll mail you the money. You go, okay, it's 37 cents or 45 cents or, you know, that's no big deal. It is a big deal. Now, you don't have this option, at least yet I understand, but some systems you have the ability to give them what's called a walkout statement with an envelope, and you go, well, if you don't have, you've already exhausted all the other options, here's your bill, the payment is due at the time of service, but since you don't have the ability to pay right this minute, when you get home, or mail it in on Friday when you get paid, or, it's not a 30-day cycle. Give them the bill then, because then they can't say, I never got a bill. You gave them a walkout statement in their hand. And let's separate those from those other 90% of your patients who the post office discriminates by not delivering the bills from you. Okay. A dog ate my debit card. Who's got a good one for this? How would you respond? What's that? Yeah, mine was more, our policy, and again, I'm just with a smile. Our policy of payments due at the time of service. You bring your dog in so we can scan him. And I smile because he's a little scanner. Okay? Or, hey, well, if your dog gets sick from eating that debit card, how are you going to pay the vet? Because whatever you're using to pay him, you can go ahead and pay me. All right, and obviously this is in jest. Okay, so, I kind of set aside a little bit of time for role play. We've kind of done it as we've gone, so I'm going to bypass this one. Unless you have, is there anything, any situation I haven't hit today that you encounter that you said, I'd really like some help on this? Okay. So I want to leave you with this last piece. What happens if the patient doesn't pay? Because we feel bad asking for the money. Poor Mrs. Landrum, she's 85 years old and she probably doesn't have any money. Her son doesn't own a large company or anything like that. And she couldn't possibly afford to pay that, $47.13. So what happens to her? Well, let's look at it. You send her 4 statements worth about $23 if she doesn't pay. All right? No big deal. You send her a statement. She didn't get around to mailing the check, and there comes another statement. You go, oh, okay. And another statement. So, wow, this is pretty cool. And I'll pay it eventually. It's only $47, right? Next thing you know, the account's charged off to bad debt and comes out to a collection agency who's calling up saying, Mrs. Landrum, I'm calling from XYZ collection agency. You have a bill with us of $47.13. Payment in full is due today. How would you like to take care of that check or credit card? And this is an attempt to collect a debt, and any information obtained will be used for that purpose. All calls are monitored for quality assurance. So this is now, poor Mrs. Landrum is getting a call from a collection agency who is not going to say anything wrong, abusive. They're going to state the mini Miranda, as it's called. But, my God, my doctor turned me over to a collection agency. Why? Because we didn't ask her for the money the first time. All right, accounts written off to bad debt without going into the hospital finance. I'm sure Mr. Pope would agree that when they write something off bad debt, it's no longer an active receivable. It can affect borrowing power and bond ratings, etc. So not collecting money affects the hospital's ability to grow, to fund its operations. Okay, this is a business, folks. It's not personal. Collection agency, and ultimately, it can go on a credit report. Now, you've now taken poor old Mrs. Landrum's $50 account that you didn't ask her for the money on the date of service. Things happen, she hasn't paid it. Now her credit report is getting affected because why? Because we didn't ask for the money at the time it was due, and we made no effort or very little effort to collect the money. I'm not talking about hardcore collections. I'm talking about asking for the money, giving them a very limited number of options, which is credit card or check or cash. Those are 3. Today, that's one option. And that's the only options, because these are consumers shopping for services as opposed to goods, but they expect to pay, and there's a price associated with it because you have to stay in business to provide quality health care to your community. So you do the patient and your practice a favor, and you collect the money up front. Use that mentality. It's consumer, it's business, it's not personal. I don't know, The price is the price is the price is the price. And I know for a fact that your pure self-pay bills are discounted by 30, you're getting a 30% discount if you don't have insurance. So they're getting a good break. So why isn't it right for them to pay it? It is right. And those people who don't pay and don't want to pay, you need to send them to your competitors. Okay? But I guarantee if you ask nice with a what? Big smile. Tell them what your policy is. Tell them how much they owe. That's all you got to do. Most of them will respond. And you do it consistently, regardless of the age, how long the person's been a patient, what kind of insurance they have. Every day, every patient, hi, your visit today is going to be $65. Your visit today is going to be $25. How do you want to take care of that today? Now how do you want to, do you want to use your check, cash, credit card? What are your options? That's it. Today. If you do that 100% of the time, you're going to be amazed at the results. And you'll be amazed at the smiles you can put on the administration's face because they're no longer having to figure out how do we fund this new wing? How do we fund re-wallpapering our patients' rooms? And how's your practice furniture look? Those are considerations. It is a business. It's not personal. Okay? And I want to thank you for your time. And I know it's hot. I know it's lunch. And appreciate everything appreciate you being here and appreciate what you do every day for your practice. Thank you.
Thank you, Fred. Hey, did everybody sign in? If you didn't,